Hey everybody, my name is Clay TC. I'm a certified licensed athletic trainer in the state of Texas. And today I want to talk about why I personally prefer ice as the modality of choice when it comes to any acute injury. The primary reason that I choose ice as a modality is to limit what's called secondary injury. So what is secondary injury? Secondary injury basically is a cascade of events that occurs due to the initial or the primary injury. So let's take, for example, that you sprain your ankle and you damage the ATF or the anterior talofibular ligament. And what ends up happening is the contents from that cell end up damaging healthy cells and so on and so forth. So healthy cells burst, damage healthy cells, those cells burst, they damage other healthy cells, and you have this cascade of effects that ends up happening. If you've ever been on the receiving end of spraining your ankle, then you tend to see inflammation, swelling, even some what we call ecchymosis or the black and blue discoloration, either up the leg, down the foot, and if it's bad enough, maybe even into the toes. And this is all due to this secondary injury and the effects that that has on the cells surrounding the primary injury. So what icing essentially does is decrease the amount of oxygen and energy that's required by the cells that are surrounding the structure. And by doing this, we tend to preserve some of the healthy cells from being damaged. So what I usually see is doctors and even some other healthcare providers, or even somebody who's been in the medical field, kind of suggest is that ice actually limits or stops inflammation or swelling from happening, and that couldn't be further from the truth. The only way that we can truly stop inflammation and swelling from happening is to already have ice on the person as they get injured. And that would take some seeing into the future. So as soon as the initial injury ends up happening, inflammation has already begun. So whether it takes me 5 minutes, 10 minutes, 15 minutes, a day to put ice on this individual, we're already starting to get behind the secondary injury curve, and it has little to no effect on the amount of inflammation or swelling that we're going to see. That's probably going to be a different topic for another time on how we can actually limit swelling. So this is basically why I would choose to ice an individual with an acute injury. Remember, we're trying to limit what's called secondary injury. We're not trying to limit the amount of inflammation. Inflammation is actually healthy and it is good for recovery. We don't want to necessarily strip the body of all inflammation, but I do only want the necessary inflammation to help with healing. Any excess inflammation or swelling can actually be detrimental, from my experience, to aiding someone in the healing process. Now I'm going to talk a little bit about why I choose to ice for a chronic injury. And again, once we pass the inflammation phase from immediate to 5 days, there's really not much that I can help limit secondary injury beyond that. Now, why I choose to ice for chronic injuries is basically just for pain management. If they have some sort of ongoing issue, um, they like the sensation or the removal of that sensation, then I would choose ice as a modality. And again, in both cases, I'm not necessarily reliant on just icing itself. And we'll get into rice, and we'll get into some movement and exercise, some manual therapy techniques. We'll get into some treatment options that you can have for injury. But for me, icing initial injuries is going to help kickstart the person on the right path to recovery. Now, the next video, I want to talk about how long we should leave ice on there, and I might ruffle some feathers. So my goal with the icing series isn't to change your mind. It's to give you small adjustments and make icing your injuries a little bit better. I'll see you in the next one.